Urinary protein-bound sialic acid, UPBSA, is used to differentiate between steroid-sensitive and steroid-resistant nephrotic patients. The aim of the study was to differentiate the nephrotic patients with steroid sensitivity and steroid resistance. This was done by assaying the urinary protein-bound sialic acid levels. The study also aimed to demonstrate the importance of urinary protein-bound sialic acid in the nephrotic patients. The study sample involved 70 nephrotic children in the age group of 1 to 8 years, of which 47 were steroid sensitive and 23 were steroid resistant. The subjects were analyzed by assaying their urine samples for the sialic acid by Anmenoff's method. The results were analyzed by unpaired student t-test. Children with first onset of nephritic syndrome and with no other major illness were included in the study. The children having chronic renal failure were excluded from the study. The study procedure involved the partial diagnosis of the steroid-resistant nephrotic syndrome patients by their response to prednisone therapy and by observing the renal histopathology. Urine samples of 100 milliliters were collected from all the study subjects before the start of the corticosteroid therapy. The samples were centrifuged with trichloroacetic acid, which causes the precipitation of the glycoprotein. This protein was stored at -50 degrees centigrade. It was assayed by Anmenoff's method to estimate the urinary protein-bound sialic acid. The procedure was continued for 18 weeks after the steroid treatment. Receiver operating curve was drawn to determine the cutoff for differentiation of steroid-sensitive and steroid-resistant nephrotic syndrome patients. Patients with response to steroid therapy and minimal or nil proteinuria were grouped as steroid-sensitive nephrotic syndrome. Children with no response to the therapy and with proteinuria 2+ or greater, even after 8 weeks of steroid treatment, were grouped as steroid-resistant nephrotic syndrome. The urinary protein-bound sialic acid was estimated in this procedure. The urinary protein-bound sialic acid levels were found to be as 2.1 microgram per milliliter in the steroid-sensitive group and 3.92 microgram per milliliter in the steroid-negative group. The receiver operating curve was drawn to determine the optimum cutoff for the differentiation of steroid-sensitive and steroid-resistant, which was found to be 2.71 microgram per milliliter. The steroid-resistant patients only had increased levels of urinary protein-bound sialic acid. The steroid-resistant group of patients were found to have more proteinuria, that is, 7.82 grams per day, than the steroid-sensitive group, which has proteinuria of 6.41 grams per day. Sialic acid is a 9-carbon, containing negatively charged carbohydrate. This sugar contributes negative charges to the proteins in the urine, which can be used as a marker for the differentiation of steroid-sensitive and steroid-resistant nephrotic syndrome patients. The patients who are not responding to the steroid therapy can thus be given alternate medication for better effect.